Thank you very much, Jonathan. All right, so we're going to keep it moving. We've got one more awesome presenter coming up, and then we will take a break together. Just as InfoSnap is solving and simplifying school registration, our next presenter is actually helping to simplify how do you create great apps in healthcare. We're kind of moving from the software as a service world now to the platform as a service world. And Medable is solving the challenge of creating a compliant, scalable, and reliable platform that companies can essentially build great apps on. And they're doing that with the support of the Rackspace Managed Cloud. So here's a quick video just to share with you a little bit more about Medable.
Without Rackspace, we really wouldn't have a product. We've solved for a really challenging problem, and really the only way we can do it is both with the expertise and the infrastructure that Rackspace provides for our company. I'm Michelle Longmire, co-founder and CEO of Medable. The problem that Medable solves is the incredible amount of resources it takes to build a technology that will be used in our healthcare system. Prior to our API, it took over a year, over $1 million, and 5+ developers to build a fully compliant, scalable application. Well, we've removed that barrier and solved for the resources, the high resource demand completely. Now using our API, a single developer can stand up a fully compliant app in less than 4 weeks. We needed a technology that would be scalable and reliable. Rackspace provides us exactly that. Now we have an API that is highly scalable, highly reliable, and enables our customers to touch the lives of patients across the world. Fanatical support to us is essentially having a partner you can rely on 24 hours a day. And when you're looking at health security, there's nothing more important than that in a partnership.
All right, so please welcome the CEO of Medable, Dr. Michelle Longmire.
All right. Cool, thanks for your time. So we'll get started. So Medable is the app and analytics platform for healthcare. I think the video did a great introduction. What we are is a backend as a service or a platform as a service for building healthcare applications. We're all here today to talk about challenges and solving hard problems and how Rackspace helps us do that. When you look at healthcare, it's clearly completely perfect, right? No, it's not. As a physician, I can tell you that firsthand, and everyone as patients has experienced so many barriers. The barriers to innovation in healthcare are tremendous, and in fact, they've limited some of the largest companies in the world, including companies like Google, from really even attempting to innovate in a meaningful way in this space. The barriers are numerous, from the regulatory environment and HIPAA compliance to even if we had systems that worked better, how do you deliver those to patients and doctors, or those insights? And then also, the system has evolved over time in a very iterative process. So how do you create technologies that integrate in the existing system? Why does it matter so much to solve these problems? I think that when you look at the hundreds of millions of dollars going into digital health, and now really billions of dollars, it's yet that technologies have really changed our lives as patients or as physicians. It's amazing to me that none of the things that are talked about, in Rock Health or the news have really touched the lives of patients in meaningful ways. And I think as patients, we're wowed by a patient portal, which would otherwise be catastrophically disappointing in any other world of our realm of our life. And so, our expectations are actually pretty low, but the potential here is tremendous. You actually have the opportunity to deliver care directly to a patient wherever they are, anywhere in the world. You have the opportunity to gather data across specific diseases, drugs, and devices across very specific populations. And this being rich longitudinal data, the data that we could, collect ambiently or directly into our phones every day. And then we also have the potential to deliver these insights directly to where they matter, right? So the potential is huge, and our opportunity to deliver on that is there, but we have to really solve for these challenges. So I teamed up, I'm a physician, and my talk is not as technical as Med Decisions, I'll give you that. But I teamed up with an amazing team of engineers, who we all set out to say, let's remove these barriers. Let's enable an undergrad or a graduate student at Stanford who's otherwise going to do a mobile food delivery app to build the next life-changing technology. Let's enable Boston Scientific, who has implanted cardiac defibrillators, to have an application that doctors and patients could look at data in aggregate and act on at the point of care. So we built Medable over the last 2 years, and it went live in its current form in May. And we feel like we've really solved for a pretty challenging problem, and we've really leaned on Rackspace to do that. So I'll dive into what Medable is by providing you an example of our customer. This is a device company out of Switzerland, and they are very impressive.
Health tracking on a new level. Monitoring at clinical grade. Non-invasive, discreet, robust, and intuitive. We measure continuously and calculate physiological parameters such as stress levels. The patented sensors deliver data which meet clinical standards outside the hospital and can contribute to a healthier life, even when you're moving. The graphical analysis shows heart rate, blood oxygenation, and many more physiological parameters. Sleep and sleep quality can be tracked too, as the device is very comfortable to wear. The highly tuned sensors function reliably during all types of activity, including high-performance exercise. Data can be stored easily and securely. Biovotion is body management at clinical grade under motion.
So, what does it take to power a device like Biovotion's remote patient monitoring tool? I think that if we dive into kind of a case study here, it will exemplify what Medable provides to the ecosystem. We partner with pharmaceutical companies to provide the technologies behind mobile apps for drugs, device companies, and a whole host of startups who are doing very amazing things in the healthcare space. Medable is we refer to it in modules. These are very connected pieces of the platform, but it enables us to kind of dissect what the offering is. And so I'll walk through the Medable modules and how they relate to what Biovotion is doing to show you kind of some of the features that we provide for healthcare companies. So every healthcare company who's building an application needs a back end, right? And this is actually a very significant challenge because this back end needs to be scalable, it needs to be secure, and it needs to integrate with existing healthcare systems. So you take a device like Biovotion's, it needs to communicate with a client, that needs to go to the cloud, and you need to have a system that relies upon that is scalable and secure. We have essentially, I think Biovotion stood up their back-end system in about 3 weeks, and today they're demoing that at Medica, one of the largest healthcare conferences in the world. And so we've really solved for providing a back-end that is highly versatile, is schemaless, and can be integrated with existing systems, while also providing a system that is very secure. And doing those things and having the proper encryption technologies and doing that at scale is a big challenge. MedDecision talked about MongoDB. We do also leverage MongoDB. And in general, we have found that there has not been a healthcare use case that has not been able to leverage our back end in a very meaningful way. So the next component is really the compliance piece. Everyone talks about HIPAA in this space when you're looking at health IT. It's a set of regulations that dictate not the specific technical requirements around what needs to be done, but it outlines very broad regulations around protecting personal health data. And it is really hard to understand, and it's hard to know if what you're doing is HIPAA compliant, because as I mentioned, it doesn't have specific methodologies, but you're expected to have best practices. And so, when you're a company like Biovotion, you don't know anything about HIPAA compliance, right? You don't want to. You want to be an expert in remote patient monitoring. You want to be an expert in building the very best device the world has to offer. And you don't want to use valuable resources around understanding the regulatory landscape of the United States healthcare system. And beyond just needing to know this, there are very significant ramifications if you have a HIPAA breach, including time in jail, actually, if you're an individual who's responsible, and very, significant financial ramifications if you have a breach. So while you don't necessarily want to dedicate precious resources towards HIPAA, it's a super important thing to solve for. And if you look at HIPAA compliance itself, it's kind of a big data problem. You have to track who saw what, when, and where for every piece of personal health information when you look at an audit. So that alone is a significant challenge. So for BioVotion, using our API, we have solved for their compliance piece. They used our API to build their application. It is secure from the client to the cloud, all of the data in transmission, the data at rest, the disaster recovery, everything that needs to be done for the regulatory requirements is achievable for BioVotion leveraging our API. And Rackspace plays a very important piece in this, and I go into this in a moment, that is around the physical security and regional security requirements that enable us to meet those for our customers. I think analytics is really the next big thing in healthcare. HIPAA will probably become a commodity, just like we see in storage, right? What is the next thing we can offer our customers that's going to add value to their applications, to their technologies? It's a really important question, and as a platform company, I think we're in a unique position to constantly roll out new product to our customers, and we're very focused on our analytics offerings. A company like BioVotion has several needs. They need to be able to visualize complex sets of data in near real time within the application at an individual level, right? You have 10 physiologic parameters. The doctor needs to be able to see that. They need to make sure that data is accurate, and they need to make sure that it's, relevant to that point in time. In addition, at a population level, they need to be able to visualize, the 1,000 or 10,000 patients they have with CHF and really study that population and be able to do that without interfacing with protected health information. Additionally, beyond just enhancing the care at this moment in time with that application, they want to think about their product in the next year, the next 2 years, when data really becomes a drug, and they're able to develop algorithms that predict some of the things that a doctor would identify in the data, and then deliver those predictions, insights, and recommendations directly to the patient. So the analytics piece of this is very important, not only in the here and now, but in the advancing healthcare piece of this. And our team at Medable is very focused on improving the analytics offerings and constantly looking at what can be done and pushing that envelope of data as a drug when we have FDA-approved algorithms. So, we offer that through our API, and I believe that not only are we solving for improving care right now, being able to see important data in near real time, but also really looking forward into healthcare. How can we take the doctor out of the equation as a bottleneck? How can we get rid of this, whole kind of tidal wave of data that no one can digest at any point in time, and wrap sophisticated algorithmic medicine around that to drive insights and provide better care that is more scalable. Collaboration is a big need among healthcare applications, right? You don't want the data to die on the phone. Clearly, we're all here talking, about cloud computing, but the data sharing and the models that are needed in each application differ, whether that's patient to doctor or doctor to doctor. In the BioVotion application, the doctor visualizes the data. They may need to share that with another physician. A patient has their application. They go see a new doctor. How do they grant access to that data to that new physician who might have their own version of the BioVotion application? So the data sharing is very important, but it needs to be configurable, and it needs to be something that can not only be done at an administrative or developer level, but also at the end application user level. So that's something that the Medable API has solved for, in enabling developers to really configure these data sharing models and customize them, and also enabling the end application user to invite someone to view the data and then authenticating that through secure authentication methodology, so you know who you're sharing something with is the person that you intended to share with. So this is just a view of kind of how our API works. It's a RESTful API, it's point and click, and this demonstrates that an administrator can provision roles within each user of the application, each user type. So you could say a patient or a doctor can share this and see this. Just a view into the configurable data sharing model. And finally, research. I think increasingly I'm doing a lot of work with groups at Stanford who are rolling grant-funded research studies onto mobile. BioVotion is launching a very significant research study looking at patient outcomes. Medicine is really shifting towards looking at outcomes, improving outcomes is a way to affect reimbursement, is a way to understand how our healthcare actually impacts what happens to patients. And Medable is providing very powerful research tools that can be used to build applications designed to study huge populations of patients. So these are configurable surveys, these are actual application features, and then in addition, on the back end, when you're looking at the data, it's enabling a research group to look at a huge cohort of population data, perform meaningful analytics on it, and not interface with protected health information so that you can, study an entire group and not be worried about seeing sensitive information. We're obviously very grateful to Rackspace. Specifically, everyone that we've worked with on the Fanatical support team has been phenomenal. We leverage Rackspace in a very key number of ways, and together we, I think, remove significant barriers to healthcare innovation. We use the managed cloud, the private cloud. We use the global infrastructure for proximity, speed, and to ensure that we have regional compliance because there's certain, regulatory issues around where the data can be stored, how it can be stored. Additionally, we want the data to speed at the time of the data speeds to be optimized, specifically when you're looking at device data. In general, my experience with Rackspace has just been phenomenal. Our developers lean on their Fanatical support team all of the time in making architectural decisions and even troubleshooting issues that we have with our own end customers. And we have just found the partnership with them and us being a customer of theirs to be something that actually defines how we want to provide that support for our own customers. It provides us a model of exceptional customer support that we intend to extend to our own customer base. It's really with Rackspace that we're able to not only have this enterprise architecture, but at internet scale and with the core security that we have to have for the field that we play in. This is an architectural diagram that just kind of demonstrates both leveraging the public and the private sides of Rackspace offerings. And again, I think when you look at what we've solved for, it's really game-changing in terms of what we provide the development community in healthcare technologies. We have reduced the time to market radically. We have reduced the costs that are needed and the knowledge that is needed radically. And now, as I mentioned, we literally have a Stanford developer, single, undergrad, stand up an app in 1 week. It's pretty cool to see, and we do that with Rackspace. So thanks to the team here, and thanks for letting me be here.